Okay, so now we will be looking at menstrual cycle. Now, menstrual cycle involves coordinated hormonal control of the endometrium that allows the pregnancy or regular shedding of endometrium during periods. Most obvious manifestation of menstrual cycle of the normal menstrual cycle is presence of regular menstrual periods and hormones from hypothalamus and pituitary detect the ovarian hormone, and they are produced by hypothalamic pituitary ovarian axis, and then they control the endometrium during menstrual process. The process is complex and its aspects initiate, control, and seize the menstruation. Now the average duration is 28 days. Duration of menstrual cycle varies from 21 to 35 days, and duration of menstrual flow varies from 2 to 8 days. Normal volume of menstrual blood loss is 35 milliliter per month. Now we will look at how hypothalamus and pituitary control this cycle. Hypothalamus produce gonadotropic releasing hormone. They are produced in pulsatile manner, and release of GnRH stimulate anterior pituitary gland to produce FSH and LH. Now, non-pulsatile release of GnRH suppress the FSH and LH production. When anterior pituitary gland produce these hormone FSH and LH in response to pulsatile stimulation of GnRH from hypothalamus, then that LH and theca cell of ovary acts and produces androgen, and FSH will act on granulosa cells of ovary to produce estrogen. So in this way, FSH and LH stimulates the production of androgen and estrogen. Now look at this. This is hypothalamus and this is pituitary gland. It releases FSH and LH. FSH and LH is released from pituitary gland, anterior pituitary gland, and that FSH and LH goes into ovary, act on it, and stimulate ovary to produce estrogen. Estrogen and androgens. Now, on that stimulation of FSH and LH, ovaries produce estrogen, and that estrogen exert effects on the different processes. And the ovaries has feedback control of estrogen production. Low level of estrogen inhibits LH, while high level of estrogen stimulates LH production. So in this way, there is regulation or feedback mechanism occurs. Now progesterone, and when low level of progesterone occurs, there is stimulation of FSH and LH occurs. If high level of progesterone, then there is inhibition of FSH and LH occurs. So in this way, this feedback cycle or feedback mechanism is controlled. Now menstrual cycle, it is regular cyclic monthly cycle, and in which ovarian changes occurs as well as endometrial changes occurs. In ovarian changes, follicular phase is there, ovulation phase, and luteal phase. These are three phases of ovarian changes in menstrual cycle. So the follicular phase includes follicular phase is variable, and this determines the cycle or the length, which is 28 to 35 days. Ovarian cycle, it lasts average for 14 days, and mainly mediated by estrogen, involves stimulation of ovarian follicle and development of single dominant follicle. Ovarian follicle is formed and single dominant follicle is formed. FSH level rises in the beginning of menstrual cycle due to low estrogen, and then estrogen starts production occurs, and then its level declines. FSH stimulates follicular development in the ovary, and level of estrogen gradually rises, and rising level of estrogen level produced by dominant follicle causes negative feedback inhibition of FSH production. So the decline of FSH causes atresia of all but the dominant follicles, and then that dominant follicle is normally only one follicle grows, and that one follicle is the largest and most developed follicle in the mid follicular phase, and then in uh, further ovulation, that follicle is ovulated. It is characterized by maturation of dominant follicle and release of oocyte. As dominant follicle grows, the highest level of estrogen causes hypothalamic GnRH pulsatility that results into increased LH production. Now, LH induced luteinization of granulosa cells of dominant follicle, and progesterone further amplifies the positive feedback level of estrogen from the pituitary secretion, leading to LH surge. When LH surge occurs, ovulation occurs at 24 to 36 hours after onset of LH surge. So, proteolytic enzymes such as matrix metaproteinases and progesterone within follicle causes follicular wall breakdown and release of oocyte. Now, LH surge is one of the best method of the time of the ovulation, and then after ovulation, luteinizing phase comes in. Luteinizing phase, what happens? Production of progesterone occurs from the corpus luteum, and after release of oocyte, the remaining granulosa theca cells of the ovary forms corpus luteum, and progesterone is produced by corpus luteum. Means corpus luteum provides progesterone for the development, and luteal phase is fairly constant 14 days. And after luteinizing phase, what happens? If implantation occurs, fertilization occurs. After fertilization, implantation occurs. If implantation does not occur, corpus luteum degenerates and result from the rapid fall of progesterone, and then the cycle will try to return in its normal state. And the endometrium, within endometrium, the menstrual cycle can be divided into menstrual phase, proliferative phase, and secretory phase. These are different phases. Menstrual phase includes shading of the dead, unsaid endometrium, and start of menstruation occurs at the day 1. While the proliferative phase includes phase followed by menstruation, in which characteristic growth of endometrial glands occurs, and then the massive development of endometrium takes place. Proliferative phase occurs, and the third one is secretory or luteal phase. This phase is characterized by the progesterone induced granulosa secretory activity. Endometrial stoma becomes edematous, spiral arteries become convoluted, and immediate prior to menstruation, three zones of endometrium can be seen: the stratum basale, spongiosum, and compactum. So in this way, this whole process runs, and different hormones control the menstrual cycle. Now, anterior pituitary hormones are ALH and FSH. They are released from anterior pituitary and acts on the ovary and stimulates the production of estradiol and progesterone. And these produces the helps in development of dominant follicle, and that dominant follicle releases the ovum, and the remaining part is converted into corpus luteum. So in this way, follicular phase and luteal phase works, and this whole cycle is of 28 days. And in 28 days, all these changes occurs, like growing follicle, ovulation, corpus luteum, and corpus albicum, and degeneration, and then the reverse cycle of the menstruation occurs on day 1. So in this way, this whole process works, and normal physiology of menstruation works in this way.